Have you ever looked down and noticed your urine looks red? It can be a pretty shocking sight, especially if you weren't expecting it. For most people, seeing a color change in something as routine as going to the bathroom can instantly make your mind race with questions and worries. But before you panic or let your imagination run wild, let's break down what's actually going on when your pee takes on a reddish hue. There are a lot of reasons this can happen, and not all of them are cause for alarm. First of all, don't jump to the worst-case scenario. It's easy to assume the worst, but in many cases, there's a simple explanation that's totally harmless. Red or pink urine isn't always a sign of something serious. In fact, it's surprisingly common and often has a perfectly innocent cause. One of the most common reasons for red urine is actually your diet. Sometimes it's just what you ate earlier in the day or even the night before. Foods like beets, blackberries, or even rhubarb can give your urine a reddish tint. These foods contain natural pigments that your body doesn't always break down completely, so they can pass through your system and show up in your urine. There's even a name for it, beeturia. That's when your pee turns beet-colored after eating beets. It might look strange, but it's totally harmless and will go away on its own once your body processes the pigments. So if you've had a big salad, a smoothie loaded with beets, or a handful of blackberries, your bathroom surprise might just be your dinner saying hello on its way out. It's a quirky reminder of how closely our bodies are connected to what we eat. But what if you haven't eaten anything unusual and your urine is still red? That's when it's time to consider other possibilities. Certain medications can also turn your urine red or pink. This is a well-known side effect for some drugs, and it's usually nothing to worry about. Some antibiotics, certain laxatives, and drugs used to treat urinary tract infections can all cause this color change. The effect is usually temporary and should be mentioned on the medication label or in the information leaflet. If you're ever unsure whether your medication could be the cause, don't hesitate to check with your pharmacist or doctor. They can quickly let you know if this is a normal side effect or if you should be concerned. Now, let's talk about what might be more concerning. Sometimes red urine is a sign that there's blood in your urine, a condition called hematuria. Blood in the urine is actually a fairly common reason for red pee. It can be alarming, but the amount of blood can vary a lot. Sometimes you can see it clearly with the naked eye, and other times it's only detectable under a microscope during a lab test. That's why doctors often ask for a urine sample if you report any color changes. They want to check for microscopic blood that you might not notice. The causes of hematuria can range from something as simple as vigorous exercise, especially long-distance running, to more serious issues like urinary tract infections, kidney stones, or even problems with your bladder or kidneys. Sometimes, even a minor injury or irritation can cause a little bleeding. For women, it's also important to remember that a reddish tint during your period is completely normal. Menstrual blood can mix with urine and change its color, so there's usually no need to worry in that case. But if you're not menstruating and you see red urine, it's time to pay closer attention. It could be your body's way of telling you something needs to be checked out. So, when should you worry? It's important to know the warning signs that mean you should see a doctor right away. If your urine is red and you also have pain, fever, trouble peeing, or see clots, you should get checked out as soon as possible. These symptoms could point to an infection, a stone, or something more serious that needs prompt attention. And if the color sticks around even after you stop eating those red foods or finish your meds, don't ignore it. Persistent red urine is always worth a conversation with your healthcare provider. Even if you feel fine and have no other symptoms, it's always better to have a doctor take a look. Sometimes, red urine can be the very first sign of a bigger problem, and catching it early makes all the difference in treatment and recovery. Your doctor may run some simple tests like a urine analysis or blood work to get to the bottom of what's causing the color change. Most of the time, the cause is easy to treat, but it's always best to be safe. Here's the bottom line. Don't freak out if your pee turns red once. It's usually nothing to worry about, especially if you can link it to something you ate or a new medication. Take a moment to think back to what you ate recently, or any new medications you've started. Sometimes the answer is right there in your daily routine. But if it keeps happening or you feel unwell, don't wait, get it checked. Your health is too important to ignore warning signs even if they seem small. Your body gives you signals for a reason, don't ignore them. Keeping track of any changes, even writing them down, can help your doctor figure out what's going on. Thanks for tuning in. Stay curious, listen to your body, and take care of yourself. Remember, a little knowledge goes a long way when it comes to your health.